Hello, everybody, and welcome to the Healthtech Pigeon podcast, bringing you the top health tech news stories and analysis every week. I'm Amy, and with me today, I've got SomX's very own Belle and Hugh joining me to discuss some of the best health tech news, supported by our lovely Adama on producer duties. Thank you, Adama. I'm still a little bit cold today. I don't know about you guys. How has your week been? And I'm aware that Belle has a little friend joining us actually on the podcast today.
Well, I'm glad the screaming goat toy got such a formal introduction, as it deserves.
And maybe the goat toy might have a vocal feature as part of the podcast. We'll see if Mr. Goat feels like he wants to or they want to. Maybe I should not.
Don't gender the goat, please,
Don't
Amy.
gender the goat. I won't gender the goat. They want to get involved at any point. We'll see.
Editor's note, at this point, Jared, we will insert the screaming goat noise. Do with it what you will. Oh my good God.
Well, after that rather alarming sound, maybe that's a good sound to kind of put us into a state of alertness as we fall and we discuss the latest stories. Before we do, though, Hugh, how are you this week? All good?
Yeah, all good. If anyone else feels like January has been hit by a ton of bricks, then it probably explains the goat noise, doesn't it?
Yeah, maybe that's just a representation of how we're all feeling.
Hinging the whole intro around the goat is a bold move, Amy, quite honestly. A very bold move for your first time hosting the podcast.
Well, let's kick off then with our very first story today, which is from Startups Magazine. And it's focusing on the health tech startups making healthcare delivery better for doctors and patients. So it's an article touching on a couple of different companies that are doing some great stuff in the space. Like the overview, is about the healthcare system being under strain. We know that. Overloaded doctors, mounting administrative burdens, and patient care pathways stretched to breaking point. As the demand on these services continues to grow, we're obviously looking at digital solutions to support new ways that we can deliver healthcare and also alleviate pressures on clinicians while also improving patient care. So what are the startups doing to address these real-time challenges? Well, we know that lots of startups across the field are working in this area, but two featured in this article are Tortoise and Equal, doing different things, both with the same sort of overarching view of improving that delivery piece. So Tortoise are a UK-based startup, and they are tackling one of the biggest pain points, which is that administrative overload of doctors. So their generative AI assistant drafts clinic notes and letters, saving clinicians a lot of time in their one-to-one appointments with patients. So essentially it works by capturing the sound in the appointment and translating that into comprehensive clinic notes and letters. And the great thing about Tortoise, they've already established quite a strong presence in the NHS with over 100 NHS primary care using the tool, and several pilots underway, including big names such as the Great Ormond Street Hospital, actively using the technology. And initial feedback from doctors and clinicians is that it massively helps them, and they can already start to see that the potential of AI, and in this case generative AI, is massively important to improve not only clinicians' working lives, but also improving patient experience. Because one of the key points of this particular work is that it allows doctors to focus more on that real patient communication, where they can talk to a patient without having to look at a screen and type notes at the same time. So it's a win-win for patient experience as well as delivery. So yeah, I don't know if you, before we get onto equal, if anyone wanted to chip in with any thoughts around, I mean, we've obviously seen a lot of coverage, and there's been a lot of coverage generally around ambient listening technology with doctors. Before we get on to other aspects of this piece, what are our thoughts generally on ambient listening technology? What's the potential there? Are there any risks and opportunities that, you know, we might want to discuss around this type of technology? Any thoughts from the room on ambient listening?
So yeah, I think Tortoise, they're such an incredible company. And I think one of the real great opportunities here is when we talk about AI in health systems, one of the key issues or problems is that implementation piece, and how do we get doctors, clinicians and hospital staff working with this technology in a way that is seamless and not adding to their workload, with the ultimate aim of actually unlocking clinical time. So it's a case of AI not sort of taking the key kind of clinical decision making off doctors, but rather reducing all the smaller stuff and administration that is just blocking out their calendars and diaries of preparing for meetings, taking notes, capturing all that stuff, even before you get to the point of actually point of care delivery. So for me, what's really nice about this technology in particular is it does this in a way that feels very harmonious and easy to use for the doctors at the point of care where they're having those appointments. And it's not something which is requiring any sort of major setup. It's not tricky technologically. It's very clear what it's doing is essentially taking live notes of your meeting and condensing that afterwards. Now, with that, there are obviously going to be things that people might worry about. I'm sure anyone who's used a digital meeting note taker or something will know that these are not perfect by any means. They can get the general gist, but it does still rely on the doctor or clinician going into those notes afterwards and checking for accuracy and making sure everything was captured that needs to be. That being said, doing a check and adding in those extra things is going to be much more time efficient on the clinician's point of time than capturing all those notes in one go is going to be, and then potentially eating into your appointment time with the person who comes afterwards. So I think this is a really interesting technology. I think there will be reservations with it, much like there will be with anything that you classify as ambient listening, because no one likes the idea of a technology listening in on things. So I think a key thing that Tortoise will have to show, and I'm sure they do, is security around where that's being captured, who it's being shared with, is it being stored locally, is it on a cloud somewhere where it's potentially at risk of someone hacking in. I think these are questions that these technologies open, which once we can be really clear on, I think the patients will be on board with it as well, because it's clearly beneficial to the clinician and to their digital notes as well. Because at the end of the day, the richer a patient's digital notes, the more useful they can be in other parts of the healthcare system as well, either now or in the future.
Yeah, I mean, for me, I think ambient scribes, from what was really interesting about when I think ChatGPT came out and generative AI kind of popped up in a really big way, and generative AI became quite dominant in the media and people started looking for use cases, is that ambient scribes were definitely the most popular option for that. We can look in the UK, Australia, the US, there's Europe as well. There's loads of great examples of people who saw the potential for generative AI as this kind of tool. And yeah, I think that's good in a number of ways, because it means it's created a competitive market for, and I think for what, as you were saying, Belle, really important technology, really potentially valuable technology. Not only did people see the obvious use case and the kind of ability to bring something to market quite quickly, but also the obvious demand for it as well. We've looked at, I think the Tortoise team themselves has done some great kind of reviews of the impact of this kind of technology on burnout, and particularly around the, how clinicians themselves are struggling with things like EPRs when it comes to just the sheer level of fatigue in using systems like this, and the impact that ambient scribes generally can have. So I think it's a very interesting sector. I think for me, looking forward, the interesting part is going to be in, as these technologies evolve, what are the, where's the line going to be? What do they evolve into? Is it an ambient scribe? Does it become something more like a co-pilot, which a number of the kind of developers in Europe are looking at, and kind of turning it into something more than an ambient scribe? But equally, it brings with it its challenges. And I love Tortoise. I think they're a great company. I first saw Dom present some of the really early findings back at the Digital Health AI and Rewired event in 2022, and it just stood out immediately what this technology could do and how well they are doing it. There are other companies, I won't name them, but particularly some of the European companies who have encountered some of the challenges with the transcription technology and the hallucination technology around it, and the potential risk that comes out of that. I think at least one of these companies was using a model that was actually just coming up with random violent thoughts during silences in the recordings. So it's still a challenge. It's these technologies are at market, but it's still a problem, and it's still very much, as you said, Belle, some things to be cautious about as we go forward with the technology. Even in those are the kind of, I guess, more like hallucinations, the sort of foreseen events. What are the unforeseen events? And I think, again, the kind of liability and whose responsibility for that final check will continue to be a big part. It's something the clinician's role in it, I think, is something we'll touch upon in other stories this week, but it's still very important.
Yeah, such an important point, and I think Tortoise is very clear that there is continued evaluation of this as it goes on, and I think a lot of companies in a similar space are very aware that needs to happen, and the evidence needs to be there that it's working and it's helping, and opportunities and risks are assessed as the process continues. But all in all, great news, and I love that point, Hugh, around that this went to market pretty quickly, and I think it's a great use case of that.
And great to see it in actual hospitals now as well, like these 4 pilots, like that's brilliant. They're actually collecting clinical feedback at this point, and so encouraging that clinicians are already saying how overwhelmingly positive this is in their practice and hospitals. So I think there's only good things to come, and yeah, it's clear that they're doing the work of making sure these things are being robustly evaluated in clinical settings, which is so important.
Absolutely. And I guess moving on from that to talk about another area of the delivery aspect, which is slightly different because we're not using generative AI, but using technology to improve healthcare delivery. And this is from a company called Equal, which is another UK-based startup looking at musculoskeletal health, which is a massively pressing problem in worldwide, impacting 1.71 billion people globally. Musculoskeletal disorders are the leading cause of disability worldwide, according to WHO. So this is a substantial problem that really does impact NHS and also healthcare services worldwide, feeling that kind of weighting of the amount of people presenting with these kind of problems. So, we have an aging population coupled with trends in how we live and work. A lot of us are working in jobs where our posture might be impacted. We are using laptops, computers, all of these kind of job roles where society has moved on from that, and it is obviously getting worse only as time goes on. However, Equal are leveraging mathematical models to support healthcare providers with triaging patients in musculoskeletal disorders and issues. So patients will get referred to the best treatments for them straight away, and allows treatment to be provided to people much quicker, and also treatment to be provided in a very accessible way for patients. So Equal have been partnering with lots of NHS practitioners to bring this forward, and actually, again, use case scenario of let's use technology to triage patients, to get them access to care, especially tackling the substantial problem that is musculoskeletal health. So they've got some great new partnerships coming along, and they've recently partnered with Sandwell in West Midlands, looking at again specific use case scenarios, working with the NHS again on this evaluation piece. So I know, Belle, you've worked with Equal and have worked quite closely with their founders and some more specific projects with them. What are your thoughts on this, maybe in regards to musculoskeletal health and generally how we can apply this kind of technology potentially elsewhere for other projects, for other problems?
Yeah, so always nice to get a chance to talk about a client on the podcast. And I've been working with Equal for the last year now. But yeah, Equal have a really interesting product in that it's actually twofold. So there's that triage piece that you've just described, Amy. So that's part one. It's basically getting people the care that they need at the right time, and in doing so, ensuring that people's time isn't spent on waiting lists, waiting for consultation, which then points them to the next point down the line. And it could be a really long time until someone gets the actual care they need. And specifically with MSK conditions, we know that people tend to get worse when they're sat on waiting lists because, well, anyone that's suffered with any sort of back or shoulder or neck pain or anything like that, these things don't get better if left alone. They get worse. So it's really, really important that it's something that we are trying to solve as early as possible. And Equal's basically just sort of circumventing that administrative pathway that people get caught up in whilst waiting for care. And if anyone here or anyone listening has ever gone to a doctor's or a GP with an MSK condition or issue or injury, you'll know that there's not much support for it. And often, not always of course, but often the advice is to go away and book a physio appointment on your own accord. For obviously more intensive conditions, that's not the case, but sometimes it can be. So there's not enough support as there needs to be, considering the size of this problem within the UK. The second piece that Equal offers is a self-management pathway. So one of the outcomes from their triage thing, there could be many. One would be to see a face-to-face physiotherapist. Another one could be to see a specialist about a consultation for the issue. Another option could be to use their self-management tool, and that would give you a personalised exercise regime to do at home on their app, with 24/7 clinical support in the background. So someone who's got a problem that doesn't need further evaluation before an exercise regime or treatment regime is started can get going on that straight away and have the access for any pressing questions or issues or injuries that occur along the way. And if at any point they need to go back into the system, they can. So yeah, this piece, it's so interesting. And as you mentioned, they're running a few successful partnerships at the moment across the NHS. The Sandwell piece, they've been working with them since COVID, really. So Sandwell noticed that their waiting lists were rising dramatically during COVID because people were even less able than usual to access the care that they needed. And they partnered with Equal at that point. They've had such positive results that they've not only continued that partnership, recently they published a paper outlining some of the impact from that. So really, really positive results there. I'd say also as well, Equal have made a real impact north of the border where I am. So in Scotland, they've had lots of partnerships with NHS trusts in Scotland, which have been running for over a year now and are at the stage of potential renewal. So there's some really, really interesting work there about not only improving access to MSK care, but also potentially in regions that are a bit more rural, have even less access than they might in a city base or in another part of the country. So Scotland's an interesting use case because if we can get access and delivery to MSK care, and this applies to other conditions as well, of course, but if we can use technology in those scenarios, it's really, really helpful because, again, every separate stage of consultation or going to hospital might be another car journey for someone, another day off work. It's so difficult to access these sorts of care where you're being kind of pinged around from person to person, or you're just having to wait for a really long time, and that pain can really set into your real life. And I'd also say as well, as an unrelated point, but before I hand over to one of you to kind of give me your thoughts on this, but another thing which is really pertinent, I think, from knowing about Equal and some of the primary research they've done and some of the secondary research that they've drawn my attention to, is there's also a really strong link between MSK and mental health conditions. And we know that mental health is another area of the healthcare service in the UK with really, really long waiting lists, and another area where being told or made to wait for treatment can lead to worsening of your symptoms. And we find that these two things are really closely linked as people deal with long-term health conditions from their pain, chronic pain that you're living with on a daily basis. It can lead to exacerbation of mental health symptoms, and the other way around as well. So people with mental health conditions are more likely to develop MSK conditions as well. So these two conditions or streams that are such a high burden to the NHS and such a huge area of unmet need, I think is something we need to be thinking about as well. So there's a kind of holistic view of physical and mental health here, and it's not mentioned in the article, but I think it's a really interesting one, because we're not just alleviating pain points in a specific pathway, we're also potentially making that lead to lesser need for other constrained pathways as well. Anyway, lots of things I've just chucked and thrown at you. What are your thoughts?
Well, in all of this, I'll be honest, I've been adjusting my posture so much while you've all been talking, just with this mental knowledge that we're talking about MSK, and I think I've been slouching across this entire podcast. I mean, it's fascinating to see what they're doing. It's incredible to see the kind of results that they've had as well. I think Equal is so important for this MSK pathway. I think, the article subtitle touches on it though. Digital triage is just such critical, important. It's one of those places where I think digital technologies have such a potential impact. We see it a lot in primary care, where there's a number of triage solutions out there that are trying to solve waiting list challenges and address some of the there's multiple problems there. People going to the wrong point of care, people going to the wrong clinician, people waiting when and trying to get appointments when self-care could be the right way, but ultimately it just delays this, and it creates challenges for the system. It creates poor experiences for the patients, and digital triage can have a really important role to play in that. We see the same thing in emergency care. Emergency care triage is just so important, but it's so often very manual. It's so very often done with a person going around with a list, and that is, I think it's really important that we can look to pathways like MSK, where Equal have had such amazing results, and identify what if any learnings so that we can take from this, and look at other pathways as well. If there are other opportunities to streamline patient access to care. And I think your point, Belle, just on the access in rural communities thing, having that access, having that direction to the right people at the right time, and even with the ability to self-manage as well, it will just be so important, particularly with waiting lists where they are across the board. Yeah,
I would say I totally agree. And I think in terms of the other conditions piece, the way Equal has designed their triaging services, they've basically taken thousands of clinical scenarios and sort of formed this kind of scenario-based algorithm whereupon people use a chatbot sort of interface to talk about kind of the problems that they've got, their specific injuries, and they get moved through this algorithm depending on their scenario. And so off the back of it, it can make really specific advice based on everything that a patient is presenting with. And there is absolutely no reason why a similar thing can't be used in other products. And I know that's something which companies are working on, is just how can we use this scenario-based algorithm to move people forward? Because if we know what the questions are and we know what the action is with a specific answer, then there's, like you say, absolutely no need for it to be someone with a clipboard making that. That is such a brilliant use case for technology. I think the applications of this are so high and so potentially impactful. And also as well, triaging takes time. How long if you've ever been to A&E and you're just sitting waiting to know the results of your triage, that alone, actually getting the kind of care you need straight away potentially. It takes up a lot of clinicians' time as well. And also not just clinicians, but nurses, other healthcare professionals that are having to sort of deal with the administration around it. So yeah, I think these sort of scenario-led algorithms, we're going to see a huge use of them, especially as we kind of move into using sort of Gen AI in combination with chatbot interfaces, things where it feels very easy and familiar for the patients to work through and use as well.
So speaking of future gazing technology concepts and ideas, obviously we spoke about Equal and Tortoise, where they're actually being implemented already in the NHS. We also have some other concepts happening which are still at the conceptual level, but still exciting in the world of health tech. So moving on to the next story, which is from a company called Withings, who's introduced Omnia, which is a conceptual smart mirror designed to provide comprehensive health assessments through a 360 body scan. At this time, you probably have an image of yourself going into the mirror, getting this 360 scan, and then appearing with lots of health analytics around all various things like heart health, lung health, weight, sleep patterns, physical activity, nutritional status, all of that stuff. So before we delve into that, how do we feel about this? How could you picture yourself using this mirror and then potentially using some of the analytics from it? What do you think?
First of all, it brings to mind, you know, the thing you step into at an airport where they're like, do you have anything on your body? It gives those sorts of vibes to me, the kind of high-tech version of what you want that to be, but in actual, nothing happens. You just go in and obviously they see stuff, but it feels very underwhelming for the actual person stepping into the machine. It brings to mind that for me, but I think there's kind of two camps here. There's the person that already uses lots of smart apps and tracking devices and things like this to keep an eye on their health, who are going to love the fact that this sort of technology can plug into that and give a real comprehensive and integrated view of health. I think that's really positive and exciting. There's the other camp, probably more like me, where we don't use any devices. I go on vibes and how I'm feeling every morning. But I'd love the idea of having a kind of an easy way to do a comprehensive health check. I don't want to use up my GP's time, just being like, am I okay? We don't do annual health checks as standard below a certain age in the UK. We obviously do at a certain age, but that's not something which most of us have access to, a sort of just check in as to how you're doing health-wise. And I think there are lots of people who would really love doing that. And it leads into this conversation, which we have all the time, on the benefits of preventative healthcare and things like that. And I think would give people sort of the nudge and encouragement from a data and evidence-led way to maybe make those lifestyle changes that they're already thinking about. But if a mirror reflected to me that my cardiovascular health could be improved a bit, and I know that already, I should go for walks, I should go for runs, I should do whatever to improve my health. But if I stood on a thing in the morning and it kind of gave me some evidence to base that on, I think I'd be much more likely to make those lifestyle changes. So I think it's really exciting. Who knows how long it'll take, but I'm all in.
I think the fact that it's a mirror as well, there's something about it like being very introspective, like actually reflective in the sense of like you start thinking about your own health. There's something quite cool about that concept of the fact that you're looking at yourself, and you've got the trends. Obviously in the video, the advertising video that they put forward, it's quite sort of futuristic, and they have the analytics kind of popping up like on the mirror screen, which obviously would be really cool to watch. How far away we are from that, I'm not sure. But I think the mirror concept is definitely a cool idea. What do you think, Hugh?
Exactly on that, though, like looking at this like future device that is this highly technologically enabled concept that brings everything together, that communicates with your healthcare provider. This is absolutely targeted at the person who has a Peloton at minimum, right?
Yeah.
This is absolutely that. And I'm like, no matter what else we might think about it, no matter where else we go, this is the mirror that goes next to your Peloton. It is not the mirror that stays in your bedroom, because I mean, this is the thing you want to have to choose to look into, right? And like, I don't want to wake up in the morning, turn to, my bedroom mirror and it tell me I'm having a heart attack or something like that, or that, I'm 36 pounds overweight and, I've got really real heart issues. You just want to keep this in the place where you go to think about your fitness, and
just
never
doing your
look at it
makeup,
ever.
and it's like looking peaky.
Yeah,
you considered a run?
You may have cardiac issues. It's like, yeah, I'm really annoyed at this mirror. No, but I completely get what they've done here, and I think this is a very interesting evolution of. It's amazing how quickly this kind of like sci-fi market of home health monitoring and personalized health monitoring has come on, and this really tapped into obviously Nico Health, who are actively doing these body scans now in London. You can pay a very simple, relatively accessible fee, obviously not inaccessible for someone who's not thinking about it, not got the capital to do it, but you can pay a relatively low amount of money for a full body scan now in a London clinic and get a series of actions that will be really valuable to you. But that is an elective decision to go and do that. It is about convenience, it is about access, it is about wanting to take that bit more control over your health in a preventative way, in a time where 5 years ago, the idea of actively, electively just going and get body scans was something very few people would consider, and most clinicians would actually recommend against. And it just shows you how far we've come in this, that we're now looking at, for $350, I can go get a body scan at Nico Health. Withings are coming out, Withings, they've got fantastic sort of smartwatches, devices, etc. Things like that will give you this impact. And it's just looking at that and thinking this is very clearly a positioning thing of going, okay, well, if Nico Health, it was sci-fi 2 years ago and is now active, open and going through, what can we do that is sci-fi now, 2 years, 5 years, is something that, okay, Mr. Peloton wants to put in his home gym. One day, who knows? It could be like 300 quid mirror, 400 quid mirror, or something like that you might think about buying in the same way that you think about getting a new phone or an iPad or something like that, or a Peloton. Other smart bikes are available. But I do think it is interesting where this is going, and it's a concept now. It might be the future. It might, and it's very interesting. Obviously, a lot of it just isn't remotely tied in there, and we're from a pathway perspective, brings up all the same old questions we talk about this from whenever we talk about biomarkers and whenever we talk about personalized health monitoring and how we use our devices, is where does that pathway go? It's like, I'm very much seeing this obviously brought out in CES San Francisco. It feels very American in the whole, like, I'm going to have all of my biomarkers and my healthcare provider. I can't see this in the UK for a while, getting to a point where you're standing in front of your digital mirror and it goes, oh, you could have this issue. You could have a real struggle here. You should get checked out by your healthcare provider, and your GP calls you. Like, can you imagine that in the UK? Your GP calls you off the back of this. Like, if you're feeling fine, GP would probably just let you get on with things. But who knows? We're going preventative. Could happen.
I think what's potentially interesting here is, you mentioned it's the home user with the Peloton and things like that. And ultimately, even if we do see this come to fruition and be a reality in a few years' time, it's going to be very expensive for a long time. And it's going to be aimed at that sort of top tier person who really wants to invest in their health. But something I think that is potentially interesting is using this in more community-based environments, such as community care, even in workplaces where they're already offering health insurance and private health insurance. They're trying to keep their workforce really well and healthy and giving them sort of the best access to healthcare and technologies before they become an issue. And actually, that's something that Equal does well. They partner with companies to offer MSK health, to the point that people are hopefully getting checked out before it becomes a real issue and leads to absences and stuff. But I can see this being something that bigger employers potentially offer as a perk, like, come work with us and you get access to not only a yearly checkup with your health insurer of choice, whichever one we've partnered with, but you also have access to this kind of full body scan as and when you want it. Access it in our company gym or whatever that might be. So I think it can be part of that sort of perk package that employers could offer. And potentially at some point, maybe we'll see it as part of community care. And so instead of going into a GP, or maybe in the GP's consultation room, you can kind of have this check-in. So it's not necessarily taking those appointments away from the GPs, but it's offering a more holistic 360, which means, because often when you're at the point of having an appointment with a GP, you're stuck for time, you're told, can you talk about one issue in this appointment? We've only got 10 minutes. But if you can have a quick scan, that gives you sort of the 360, then you talk about your one issue. You know that you're not on a sort of time limit to hit all the 3 things that are worrying you, and you're not sure interconnected, and you don't want to sort of bring up unnecessarily. So it could offer some kind of nice wraparound data at that point as well. So I can see this being used in lots of potential environments in addition to the empowered home user. And I think really, and also like how Nico have done it, they've obviously done it where you can pay for an appointment at a time. That's also another option that we'll see things like that. So
I can imagine it in the office environment now. Why does no one use the office canteen or take any snacks anymore? Because we put the mirror in there, like, it tells them too much. I'm being flippant there, but on a serious note, I think you're really right, particularly as we look at the kind of workplace health checks thing going on. And there are obviously some really already established provider of workplace health checks who are doing fantastic work in that. Looking at Sisu, for example, who have those devices for the kind of workplace check. And they have really valuable output. But I think you're probably right, as the kind of more informal approaches, some of the kind of this might present potentially a kind of lower access point to that kind of support, which does feel very relevant.
Well, on that note, we have our next story, which is about regulating AI in healthcare. So somewhat related to, some of these ideas of where and how we adopt these kind of technologies, whether it's in the workplace or beyond or for personal use. But the story in question is from Healthcare IT News, and it's about Kaiser Permanente's new head of AI. The focus of the piece is around 2 shifts in that technology will enable, but interestingly, it's also centered on the actual creation of this role within the company. So the company is a very large US-focused healthcare company interacting with multiple insurers and medical practitioners in the US. And they have over 40 hospitals, 600 medical offices, and have created a role of Vice President of Artificial Intelligence and Emerging Technologies. And they've hired Dr. Daniel Lang late last year. So I think there's a really interesting, a few interesting things to discuss with this. One is the actual creation of this type of role. Why now? Why do we need it now? Obviously, there's some obvious answers to that, but why create this role now? And what do they do? What is their role? And what kind of skills would you need to have in that kind of role to make sure that some of the things that we've discussed today and we discuss regularly on the podcast around ethics, around access, around inequalities, like how are we incorporating that in these type of roles, and are we equipped? Also, should more companies be creating roles like this, and can they sort of be leading a bit of a guidance on how to formulate teams and the skills required to actually assess emerging technologies in healthcare? So Dr. Yang gives a very nice detailed Q&A with Healthcare IT News, talks about a few different areas that he believes are important with emerging tech. One of the points he raised was that often people in these roles who are assessing AI are not from a technology background, and actually are often potentially clinicians, but don't have that technology understanding. So that's something that perhaps we could discuss on what we think our thoughts are on that. The other sort of key points that he mentions around not looking at AI as just a solution to solve health problems, but looking at what we want from healthcare as a whole and how we can use AI to support that. And obviously, then later explains some of his thoughts around ethical considerations of AI, which is obviously a very big topic. He even mentions implementing ambient listening technology, which we previously discussed, around the massive benefits of that. And maybe that's a good example of, obviously there are ethical considerations with things like ambient technology, but essentially it's quite a simple case of trying to alleviate burdens from clinicians and burnout. So quite a few things to unpick in this, but interested to hear your thoughts initially on, why have this role? Is it needed? Do we need more people in this kind of role? And what do you think are the skills required in this kind of role?
Yeah, so, I read this one with quite a lot of intrigue because, because I think we've seen these roles popping up quite a lot in hospital systems across the world, particularly those like really large institutional ones, things like Guy's and St Thomas's in the UK here, a particular note, but also Kaiser Permanente, Cedars-Sinai. They're all hiring these roles, and I think, I might be the only one, but in my head, I've got you say chief AI officer or, head of emerging technologies. I've got this vision of someone, sitting in a room, just imagining and like powering things and using their technological ability to solve problems. Someone comes to them and says, let's do this. Let's make it happen. They dive into a massive code and build a solution. And obviously that's wrong. Obviously that's it, because that's not the point. Like, it feels very similar to the kind of the CTO, the chief digital officer within hospitals. It's just focusing on a slightly broader thing. So obviously digital teams within hospitals, they're looking at what the kind of solutions that are available, assessing them, looking at the kind of business cases around them, and making sure that you have an aligned strategy for digitizing your hospital. And obviously AI is that, and it does need a dedicated role because we've already talked about it. This has exploded recently in AI. Last 5 years, AI is dominant. 1 in 3. No, I think it's something ridiculous, like 1 in 3 health solutions being funded at the moment that's scaling is an AI solution. So someone who is able to sort the wheat from the chaff would be a really mean way of putting it, but bring in the solutions that align, put together a strategy for where AI can fill those gaps, and understands the kind of market, understands the needs, particularly the clinical need, but also the wider operational need for a hospital system, and put together a strategy that allows you to focus on getting the best out of what is essentially still new, that is a still emerging framework. And I think that job does need to be someone who understands technology, who understands the potential for data, because without data, AI is struggle. But look at what you have, what gaps you need to fill to make the most of things, and turn it into something real that does provide value, and who can filter that. And that is definitely a role that needs to exist. It's so important right now, alongside the kind of traditional digital infrastructure of a hospital, digital teams that are kind of pushing forward the transformation within hospitals. It's all very well to look at, what can we do? And it's like, what should we be doing now that sets us up for 2 years from now? And having that future gazing thing, I think, is really, really important.
I think on that, one of the things that's quite interesting here is Dr. Daniel Yang is a clinical doctor, and he mentions in the piece that he is still a practicing clinician, and most of the AI leaders that he knows are also practicing clinicians. And one of the reasons that he says in this Q&A as to why that's so valuable is it allows him to have an awareness for the daily challenges clinicians face, but also an empathy. And he says, I bring that empathy to my role every day as we consider how to deploy AI and new technologies in ways that enhance patient care and minimize risks. So it's this deep awareness of not only the challenges, but Why should we care? What are people really struggling with? Like, where are the pieces where we can make the biggest impact in like the day-to-day struggles and frustrations, be they practical or emotional, that clinicians are facing? And I think that's really good. And I think one of the other things he mentioned is being a clinician first and foremost brings with it a whole suite of communication skills that he says allows himself to showcase the practical benefits, but also scientific accuracy of these things to ensure that we're actually making impacts. So it's this kind of medical grounding is providing empathy and communication, which not only allows these companies to produce better and impactful AI tools, but to really communicate why they're gonna and how they're gonna produce that impact on clinicians and patients as well. So I think that's really fascinating, and I really like as well that in this piece they link to an article that he's authored on the Kaiser Permanente website about the 7 principles of responsible use of AI in healthcare, and these are sort of the guiding principles that go across everything that he does and that Kaiser Permanente are doing across the business. And if you read them, it's talking about privacy as one, assessing for reliability, focusing on outcomes, deploying tools transparently, promoting equity, designing tools for customers, they might be members, doctors, employees, and building trust. So you didn't hear the word there of like just AI technology. It's grounded in making sure that these things are done really responsibly. So yeah, I think important.
Yeah, and it's great, as you said, that he comes from that clinician angle, which is really, it's not about that AI is progressing. It's about improving healthcare from the ground up, and having that perspective is really valuable. So maybe this idea that he mentions at the beginning that people aren't technologists, it's you need both. You need the clinician angle and the technology angle, and it's really important that we don't just have lots of tech people in these positions, because we need to include all the perspectives of the challenges that we're actually addressing. One of the other points that he mentioned, which I thought was quite a nice way to understand how some of the AI is deployed, he talks about care models, and he says evolving from a one-to-one model of care, which is one clinician, one patient, to a one-to-many model of care, while maintaining or enhancing quality of care and patient experience. The use of generative AI for personalized tutoring and education is an interesting model as well. So I quite like this idea, that way he describes it, because it's about shifting the type of models that we have, which typically one-to-one, fine, but we don't have to do it in that way. We can do one-to-many. We can use tools to reach more people. We can, as we mentioned previously on the podcast around triaging, we can use the tools to actually implement on a larger scale. And that's essentially a great thing that we can utilize in the tech realm. So yeah, I think a great piece, and he looks very smiley in his photo. So
yes,
we like that too. We like that.
I trust him.
Yeah, I think that's a wrap for today. We're coming towards the end of Pigeon, so thank you so much for listening. Thank you everyone for tuning in. As always, to Pigeon, we appreciate all of you listening and reading Dodo as well. So thank you again for listening to Pigeon, and you can find more information on jobs, podcasts, and events at healthtechpigeon.com.